I was diagnosed at 65.
37, earlier than most.
Every 9 minutes, someone is diagnosed with Parkinson's disease.
And every one of them can turn to the American Parkinson Disease Association. Visit apdaparkinson.org to learn more and show your support today.
Listen, I'm thrilled to be here. My name is Denis McDonough. I'm Secretary of the Department of Veterans Affairs. Thank you for the opportunity to come chat with you. I'm here because I was invited by Senator Jack Reed to come. He is a leading advocate for veterans and a tireless advocate for Rhode Island's veterans in the United States Senate. And he, as I like to say, invited me to come to Rhode Island. And when Chairman Reed invites you somewhere, the answer is yes, sir. I'll be there exactly when you want me. So I'm thrilled to be here with him, and we're joined up here by Larry Connell, the director of this great medical center, and we'll be joined in a minute with Ryan Lilly, who's the director of this vision of New England for VA. I just have one opening comment, which is that we've just come from the emergency department, and it was packed, and it was busy, and it is packed and it's busy because we have a lot of vets who get their care here, but it's packed and busy because it's too small. And thanks to Senator Reed, hopefully we'll change the law in the coming months to increase what we call small construction, minor construction projects from a limit of $20 million to a limit of $30 million. And that's meaningful for this emergency department because when that law gets changed, Larry and his team can complete the construction of the new emergency department here at Providence because the price tag on that is $24 million. Senator Reed has been tireless, as I said, in helping us work through problems like that, big and small, to ensure that Rhode Island's veterans get the care that they have earned and the care that they deserve. So, thrilled to be here. Look forward to your questions. Thanks so much. I don't know, Senator, if you want to make any comments.
I just want to thank the Secretary for joining us here at the Veterans Administration Hospital. I've had the privilege of knowing Secretary McDonough for many, many years. He's one of the most extraordinary public servants we have. I know when he is more knowledgeable of the subject, more prepared to deal with issues as they arise, and completely dedicated as the Secretary to the veterans of this country. And it's just thank you, Secretary, for coming. I always say we have the best Veterans Administration hospital in the country, and I think we demonstrated that today. And it's the new facilities, but we need better facilities, and we're working on it. But the real key, the people. We saw that reflected today in our many conversations with dedicated nurses, dedicated staff members, the housekeeping people we spoke to. What comes out of this visit is a reaffirmation that medical care involves science, technology, structure, everything else, but at the heart of it is a compassionate caregiver. And boy, oh boy, do we have it here. Amen. And I'm so proud of this Veterans Administration, this hospital. And under the leadership of Secretary McDonough, we're going to do great things, not just in Providence, but across the nation. And with that, I think we would like to recognize.
I think we can go straight to questions.
We can go straight to questions?
Yeah,
okay.
Great. Any questions, guys?
Mr. Secretary, notwithstanding the funds that Senator Reed may help line up, are you getting the kind of support that you need financially?
I could not be more thankful to Congress, Republicans and Democrats, for the investments that they make in VA and our ability to provide care to veterans. On average, our healthcare account has grown at about 9% a year for the last several years. That is manifestation of the generosity of the American people. Nevertheless, there are veterans who may still feel isolated, especially as we approach the holiday season, may feel, or their families may feel in crisis. And if there are veterans here in Rhode Island who feel that way, please dial 988 and press 1, and we can get in touch with, you can get in touch immediately with trained professionals to get you access to mental health care. If you want to see someone today under a new law called the Compact Act, whether you're enrolled in VA care or not, you can go to any hospital. We'll get you care for that crisis, and then we'll manage paying for that. So it's programs like that that will make sure that our veterans have the support they need, even in crisis.
Talked to Senator Rhode about this, suicides among veterans, and you feel that VA's got a better handle on this?
I won't feel like we have a better handle on it until there's no veterans deaths by suicide. We just released our most recent data on this last Thursday. We saw from 2020 to the year 2021 an increase of about 114 deaths by suicide among veterans. There are more than 6,200 deaths a year by suicide among veterans. So we are taking aggressive and urgent steps, empowered with new authorities and new funding from Senator Rhode and his colleagues. But until we're to zero veteran suicides, we won't rest and we won't think that we've got our hands on it.
Mr. Secretary.
Yes, sir.
Hospitals across America, regardless of their function or their target audience, are facing crises, financial
Yes.
and otherwise.
Yes.
So amongst the challenges you're facing, what steps is the Veterans Administration doing to buttress the financial support as costs continue to explode?
Yeah, and it's an excellent question. I want to just take a minute to shout out Larry Connell, our Med Center Director here in Providence, and Ryan Lilly, who oversees all the veteran healthcare facilities, community-based outpatient clinics, and hospitals throughout New England. Mm-hmm. And I think in New England you can see some of the things that we're doing. A dramatic expansion of access to care through telehealth, which increases access for veterans, reduces travel burden for veterans, and by the way, increases availability of healthcare providers, so it increases access for other veterans as well. All of it at a lower cost per unit of that care provided. We're also investing across New England in veterans' whole health. So we're not just treating manifestations of disease, but we're working with veterans, whether that be on substance use disorder, or whether that be on managing pain, to make sure that we are investing in the veterans' whole health, to include, as we saw here, with the new kitchen, buy order meals so that we have healthier nutrition outcomes for our veterans. That too is a lower cost intervention with longer term benefits. Third point, and maybe the most important point, we are constantly looking at how to manage costs in the VA. And we're constantly looking at how to manage outcomes for excellence. So I want no veteran to ever think that he or she should not come to VA because it somehow is a burden. It is not. This is an obligation. The president calls it our one sacred obligation as a country that we take very seriously. And Congress, Republicans and Democrats, invest in us every year to do that. So even as we're reducing costs and increasing the number of veterans in our care, I don't want any veteran to think that they're going to have to wait in a line, or they're going to have their care rationed, or that they're somehow taking care from someone else. We're here for them, for every veteran. We want a relationship with every veteran in the country. That's what our goal is. That's what we'll keep working on.
You had the opportunity to work with and see firsthand Operation Stand Down, which What were your impressions, and what do you see as the role of organizations like that, which are largely locally driven, volunteer driven, in the big picture of veterans healthcare?
Yeah. That was our first stop this morning, over in Johnston. And what a great way to start the day. Those employees, overwhelmingly veterans. Tony, the founder of that movement, Marine veteran. Eric, CEO, the executive director of that organization, now veteran. Veterans helping veterans, it's awesome. Second, yes, it's a locally driven partnership, including important state level representatives, including one of the state level judges, who once a year goes and convenes court proceedings for the Veterans Court. And significant investment from the federal VA to ensure that our veterans not only get a roof over their head, but then get access to care and the wraparound services necessary to ensure they don't return to the street. So since 2009, we've seen about a 60% reduction in the number of homeless veterans in the United States. But like veteran suicide, until there are 0 veterans homeless, we will not rest. It's our view at VA that the phrase homeless veteran should not exist in the English language. And we are bound and determined to ensure that it doesn't. And local organizations like Operation Stand Down Rhode Island make that very important goal an achievable reality, and I could not be more impressed by it.
Thank you.
Let me just follow up by saying, under the Secretary's leadership, VA is making improvements. It's probably one of the most efficient hospital systems in the country. In fact, I would argue it is, because the VA is not just a hospital system. It also assists veterans with housing. It assists veterans with education. It assists veterans in so many ways. So we are able to support them in the hospital, outside the hospital, and that is critically important. And we're going to go down and visit with our VA claims officers and the other responsible individuals to make sure that we're doing all we can to support the veterans of the state. But I really was eager to get the Secretary up here because I'm so proud of this facility and our whole system that I knew he would be too, and I think he will. Okay. Mission accomplished.
I might just say this, just one thing on that last point that the chairman makes, which is a new law as of August 2022 called the PACT says to Vietnam veterans exposed to Agent Orange who today have hypertension, we now can connect your Agent Orange to your service in Vietnam, meaning we can get you additional care and benefits. To the more than 4 million veterans who served in the wars in Central Command from 1991 and the liberation of Kuwait, all the way through the summer of 2021, when our presence in Afghanistan was ended. Those veterans who stepped foot in Central Command now qualify for care and benefits. So those veterans, be they Vietnam War veterans or veterans of the Central Command wars, please visit us at va.gov/PACT. Let's file a claim and get a relationship with you at VA. Access to care, access to benefits.
Thank you.
Thank you.
Thanks, guys.
Thank you.
All right. Thanks for waiting for us. Thanks for your patience.